Today I'm going to talk to you about the role of diet in cancer prevention and cancer prognosis. As it was mentioned, I'm the head of the Nutrition and Metabolism branch at the International Agency for Research on Cancer. So my presentation will be outlined following these points. I will briefly present cancer incidence in the world. I will introduce the concept of the role of diet and nutrition into cancer. There are several opportunities for cancer prevention, and then I will conclude by mentioning some evidence on diet, the role of diet in cancer prognosis. So this is a picture that the International Agency for Research on Cancer produces every few years. I think most of the audience, I guess, is familiar with these. The picture shows the incidence of cancer, all cancer sites together across the world. And you can see there is a huge heterogeneity across different parts of the world. Now, this is the results of a lot of work, but the picture masks many different elements related to its heterogeneity. For example, this is what happens in Europe. You could see that cancer overall has an incidence of about 300 new cancer cases every year per 100,000 person years. And you can see that there is a lot of heterogeneity. It's not necessarily east to west or north to south. Is really scattered, and sometimes it's really incredibly complicated to identify geographical patterns in the incidence of cancer. This is the left side of of my slide. On the right side, you can see the cancer incidence trend over the last 40, 45 years for a few countries. So you can see this is the rising trend in the UK in the last 45 years, and you can see that there are a general increasing trends in all the countries that I spotted here. You can see very steep increase in cancer incidence in places like China that, of course, are expected to produce a huge number of cancer cases in the years to come. So in 2022, it was estimated that approximately 20 million new cancer cases were diagnosed. And the other bad news about it is that about 10 million people died from cancer worldwide in 2022. And as I said, these trends are expected to go up. And by 2050, so in 25 years, the number of cancer cases predicted to be diagnosed every year is about 35 million, which is a massive number. So, of course, one of the strategies to fight this increase in incidence is prevention, and diet and nutrition have been recognized as factors that could modulate cancer risk. And of course, this has been the subject of a lot of research. How much of cancer incidence is due to diet? So the first scientists that addressed this question were Doll and Pietro back in the 80s. They estimated the populational attributable risks of different factors related to cancer mortality in the US population. And back then, the estimate about the role of diet was 35%. But you can see that, so they were saying if the US population was following cancer prevention recommendations, there is a possibility to reduce cancer mortality by 35%. You can see that there is a lot of uncertainty because the percentages varied between 10 and 70%. And there was alcohol estimated to have a 3%, and there was very little mention of obesity and physical activity. Since then, many other scientists focus on the question, what is the impact of diet and nutrition on cancer incidence. There was a study conducted by my colleagues, Isabel Sergio Mataran, is 7 years ago now. So she estimated, this is estimates for France. She estimated that the population attributable fraction for smoking was 20%. The diet, you could see, it went down to 5%. Alcohol went up to 8%, and obesity 5%. Estimates for physical activity were lower. They were about 2%. There has been studies also in other populations in Australia, in UK, and they more or less they were consistent with these figures. The summary on the evidence on dietary and nutritional factors cancer risk has been summarized by the World Cancer Research Fund, which is a charity institution based in England. So the slide is a little bit complicated, but you can see on here on the horizontal axis, these are all the cancer sites, and on the vertical axis here, there are mentioned many different dietary items, and green spots indicate inverse associations, whereby red spots indicate positive association. You can see that there are specific cancer sites that have been related to several dietary items, like colorectal cancer in particular. It was inversely associated to whole grain and dietary fiber, as well as dairy product and calcium supplements. But there were also positive association, red meat and processed meat. The WCRF report also evaluated the role of body fat. You can see that body fat was associated to to the incidence of several cancer sites here, as well as physical activity. To say that the role of these two factors has been heavily underestimated in the past. Another element that is quite striking, the fact that there are so many different combinations of exposure risk factors and cancer sites for which we don't have established evidence yet. Why is this important? Well, it's important because based on this evidence, we can estimate preventability of different cancers. So if we focus on the upper quadrant here, this is breast cancer in relation to body fat, physical activity, and alcoholic drinks in 4 different contexts: in the US, in UK, in Brazil, and China. And you can see, although they indicate consistent patterns, there is quite a level of heterogeneity on the proportion of cancer cases that could be prevented if cancer prevention recommendations were met. So this is for breast cancer. You can see for liver is very similar, body fat being incredibly heterogeneously distributed, at least the preventative part of that. And this is for colorectal, again, quite a lot of heterogeneity between factors, but also across geographical contexts. And here is the endometrium. That is a cancer strongly associated to body fat and obesity. So evaluating and estimating the link between diet and cancer has been challenging, because nutrition is a very complex science. It's also a very complex behavior. Is something that is made of very intercorrelated components, and incredibly difficult to isolate them. Also, vast majority of studies on cancer and diet rely on self-reported questionnaires. And when people are asked about their dietary habits, of course, they make mistakes, because it's very challenging to remember what we eat. There are other more technical problems. There is a continuous gap on the knowledge about the mechanism between diet and cancer. Of course, cancer is not one disease, is many different diseases, and even within one anatomical location, um, different cancer types emerge, and so is quite complicated. Also, we can think that many of these effects are weak, at best moderate, so it's very difficult to detect them. And of course, there are limits in the epidemiological design that we utilize to investigate the diet and cancer as a relationship. Now, what is our perspective? Well, probably I think it's fair to ask ourselves whether diet has an impact on cancer risk directly. Possibly one can think that diet could contribute to cancer risk primarily through obesity and metabolic dysfunctions. Also, inflammation is a candidate pathway. It's very complicated to capture some of these aspects. And as I mentioned, the fact that we rely on self-reported assessment is a limitation. However, if we were in the recent past, the methodology has improved, and now we rely also on genetic instrument to assess the diet and cancer relationship, as well as biomarkers. But this is my only slide about to describe you the International Agency for Research on Cancer. Is a WHO agency based in Lyon, has a mission to coordinate research to describe the occurrence of cancer. We are the one that produce those beautiful maps that I showed earlier to understand the cause of cancer, as well as to implement and evaluate preventive strategies. What we do at IAC is also promote and coordinate global collaborations among researchers. So probably most of you are familiar with the IAC monograph programs, a program that evaluates carcinogenic agents based on evidence based on evidence available from either experimental studies as well as human studies and epidemiological studies. So for what diet and nutrition is concerned, there were a few items that were classified as group 1. So group 1 are those carcinogenic agents with sufficient evidence in human. And these are alcoholic beverages, processed meat, aflatoxin, salted fish, as well as excess body fatness. In the group 2A and 2B, the agents with limited evidence in humans, although with some evidence in experimental studies. And we find red meat, acrylamide, mate is a beverage that's usually consumed at hot temperature, as well as nitrate and nitrite that are involved in processed meat. Yes, I happen to lead the nutrition and metabolism branch, which is a multidisciplinary environment where under the same roof we have cancer epidemiology as well as biostatistics and laboratory facilities. So you can see here a picture of the newly built IAC building. This is the biobank and this is the laboratory facilities of the branch. What we do in the NME branch is to coordinate the EPIC study. And EPIC is a large European study that stands European Prospective Investigation into Cancer and Nutrition that back in the 90s recruited over 500,000 cancer-free study participants. The study is jointly coordinating between IAC and Imperial College London, and we have a wealth of different data on diet, on lifestyle, and as well we follow up study participants over time, and we assess whether they develop cancer and whether they die or are alive. We also have a biobank. I showed you the picture a minute ago, because some 380,000 study participants gave biological material which is stored in liquid nitrogen at very low temperature. So this is in a nutshell the design of the study. So the recruitment occurred between 1992 and 1999. Dietary and lifestyle questionnaire as well as blood samples were collected, and then people are followed up. And then, of course, the exposure profiles of study participants that do develop cancer and do not develop cancer are compared, and estimates of associations are quantified. So I'd like to present now a few studies, and some of them that received quite a lot of attention. This is a study by my colleague Inge Übricht. Is about the evaluating the potential associations between processed food and cancer. This is a study published in the Lancet Planet Health 2 years ago. So we used the NOVA classification that was linked to the epidietary questionnaire measurements, and then participants' diet was scored into the different groups, indicating minimally processed, some processed and ultra-processed food. And then substitution models were used to assess the link with cancer risk. So apologies again, this is a fairly complicated slide, but what indicates here is that for head and neck cancer, we observe a fairly strong positive associations with ultra-processed food and risk of this cancer. And there were also indications that participants whose diet was characterized by minimal level of food processing were inversely associated with the risk of basically all cancers here. You can see that there were also several cancer sites that were positively associated with the NOVA3 classification. The same study, this was another study carried out by my colleague Heinz Freisling. So we focused on cancer, but because in EPIC we are in a position also to assess occurrence of cardiovascular disease and diabetes, we quantify the link between ultra-processed food and risk of cardiovascular disease, type 2 diabetes, as well as multimorbidity, which means participants that develop more than one chronic conditions. And you can see that ultra-processed food was consistently and positively associated with the risk of all different chronic diseases. Now, I alluded to that already, but when we talk about diet and cancer, we also need to talk about nutrition, because this is really the biological components containing food. And research goes straight into other components: alcohol, smoking, obesity, and physical activity, their lifestyle, really. And when we talk about physical activity, it's fair to ask questions about the environment. And so there are several environmental factors. And ultimately, all these factors determine what is commonly defined as metabolic health. So this is a study that I conducted using longitudinal data in the EPIC study. So we decided that rather than focusing on specific dietary constituent or dietary items, we were using a score to reflect adherence to healthy lifestyle. So based on diet, on smoking habits, on alcohol, on physical activity, and on level of obesity. And we could see that people, compared to people that were stable, people that worsen, so people that over time adopted bad habits, and they had an increased risk of developing colorectal cancer. Even more importantly, we were able to show that people that, on the other hand, that improve their lifestyle profiles, so they tend to do better over time, their risk of developing colorectal cancer went down. This is another important activity: alcohol and cancer. This is somehow underestimated how the fact that alcohol is a carcinogen and is related to the risk of several cancer sites. So the first one is the cancers of the upper aerodigestive tract, is also associated to liver cancer, to colorectal cancer, and to breast cancer in women. So in 2020, it was estimated that 741,000 new cancer cases were attributable to alcohol consumption. And of course, this is a small proportion, but still is incredibly relevant. It's 4% of the total number of cancer cases. Remember, in France, it was 8, simply because in France, the consumption of alcohol intake is higher than in several other parts of the world. In the couple of years ago, the IARC handbook program evaluated the effectiveness of reducing alcohol intake as a way to reduce the risk of alcohol-related cancer. And this is a study that I have coordinated. It's a pooling project on alcohol and cancer, focusing on cancer sites that whose relationship with alcohol is not established yet. So we pulled together data from 30 cohorts. It was a massive undertake, and we evaluated several cancer sites. The upper aerodigestive tract cancer, we were particularly interested to see whether we could observe an association in never smokers. And we could see that we found a fairly strong associations in never smokers. For the pancreas, this was a study that was published last week. We showed a positive associations, more evident for consumption of alcohol intake exceeding 2 glasses per day on average. Thyroid was a cancer site that was inversely associated to alcohol intake. When we talk about obesity, I mentioned this is associated to several cancer sites. And now we are entering into a new generation of these studies because we realize that not only is important to focus on obesity, but also on metabolic health. And the combination of metabolic health and obesity is something that will possibly receive in the future years a lot of scientific attention. So apologies for a lot of symbols here. Again, another busy slide. But here what we did is we compare metabolically unhealthy, overweight and obese participants versus participants that are metabolically healthy and have a normal weight. And you can see that very often the combined effect of obesity and lack of metabolic health act synergistically to increase the risk of several cancer. And this was the case for overall cancer as well as obesity-related cancer. Strong associations were observed for colorectal and of course these heterogeneous associations for breast cancer. Right, I'm going towards the end of my presentation by touching upon cancer survival. So this is a slide from the Cancer Research UK that summarizes the standardized 10-year net survival for different cancer sites. You can see that the size of this little dot here indicates the frequency of the different cancers. And if we compare the age-standardized 10 years net survival rates in 2010 versus the ones observed in the 70s, there has been a uniform increase everywhere. And the increase has been, of course, a little bit different, but there are even very frequent cancers that whose survival has improved dramatically in the last 40 years. And this is the case particularly for prostate and breast that generate a lot of cancer cases every year. This is largely due to recent improvements in cancer screening, of course, but also diagnostic capacity of promptly detect cancer and treatment. And what happens is that cancer survivors live longer than before. Therefore, it's incredibly important to establish recommendations for cancer prognosis, for cancer survivors. And WCLF, again, they reviewed several risk factors as a part of their Global Cancer Update program. For breast cancer survivors, they highlighted some limited evidence that foods that contain soy might reduce the risk of death and as well as the risk of breast cancer recurrence. There was also evidence that dietary fiber and healthy eating patterns could reduce the risk of death. Also, physical activity was something that was recommended for breast cancer patients. Body weight for breast cancer survivors, there was an evidence that having higher body weight after breast cancer could increase a woman's risk of dying. And this is due, in fact, to several factors, although this is the subject of research. Circulating estrogen as well as insulin resistance and insulin levels, together with levels of systemic inflammation and adipokine levels, they could be potential pathways through which obesity influence the prognosis of cancer survivors. For colorectal cancer survivors, WCRF recommended to increase physical activity and also recommended to increase dietary intake of whole grain foods, as well as to reduce sugary drink intake. Yeah, I have this is my last slide. I think I managed to persuade you that nutritional epidemiology is a complex science that nevertheless produce fairly relevant evidence for the role of diet on cancer etiology. There are a lot of methodological challenges. It's probably a good idea not to focus on specific dietary constituents, but probably taking a look at diet using the concept of dietary pattern or lifestyle indices. We need good data. We need a lot of data. Research on cancer prognosis is essential because we are facing an increasing number of cancer survivors, and we need to be critical about the evidence we produce every day. Thank you for your attention.